Hi, I'm Sabine Brown. I'm the Outreach and Advocacy Coordinator for Oklahoma Policy Institute and the Coordinator for Together Oklahoma. And I am here today with Carly Putnam, who is our Policy Director, to talk about some changes that might be coming to SoonerCare. So Carly, a proposal is being considered by DC that would make drastic changes to SoonerCare. Can you tell us about what those changes are?
Yeah, so this spring the governor and the legislature directed the state Medicaid agency to put together a proposal to cut SoonerCare coverage for really low income parents who don't meet a work reporting requirement. This proposal has already gone through some state administrative requirements, and it's now been sent to federal regulatory authorities in DC to have them weigh in. And what's happening right now is what's called a public comment period, where the proposal is just available for people to write out their thoughts and opinions, and the federal regulators take those into account when they're reviewing the policy. So Oklahomans have until this Friday, January 18th, to go to oksays.com and leave a comment.
So who all would be affected by this change if it were to be implemented?
If it's implemented, this would affect really low-income parents, primarily single mothers. And this is a problem for a whole number of reasons. One is that there's a lot of research showing that most people on SoonerCare who can work already do work. So this proposal, if it's meant to encourage work, really isn't necessary. And that those who don't work usually have a really good reason for not working. They either have a chronic illness or a disability that makes it next to impossible for them to find and keep a job, or they have caretaking responsibilities. They're looking after their kids, they're looking after an adult sibling with a disability, they're looking after their parents as they age. And those responsibilities are super, super important, and they keep them from working outside the home. We also know that when parents lose access to health coverage, their kids are likely to lose access to health coverage. We already have some of the highest uninsured rates in the US for both adults and children, so this proposal is pretty much just going to make this worse. And we know that these systems are difficult to navigate, and so especially for busy parents, for people with disabilities, parents with disabilities, it's really likely that people who should either be able to report their hours or should be able to get an exemption are instead going to lose their health coverage, and with that, the ability to see a doctor or fill a prescription.
So this policy's already been implemented in Arkansas. Can you tell us a little bit about what their experience has been with these changes?
Yeah, so Arkansas implemented something similar about 6 months ago, and it has kind of been an unmitigated disaster. About 17,000 people have lost coverage so far, and there's a lot of reporting showing that it's often people who either were working or should have had an exemption who just couldn't figure out the bureaucracy or didn't understand that they even had to be doing something at all. So there was a case even reported of a guy who had Medicaid coverage in Arkansas. He was working, he didn't understand the reporting requirement, he lost his health coverage as a result. They cut off his Medicaid. And so he couldn't fill a prescription for a chronic condition he had, and then he got sick, and then he wound up in the hospital, uninsured. Because he was in the hospital and missing work, he lost his job. So now he's out of the hospital, has a pile of medical debt, and no job because of this requirement that is ostensibly to encourage work. There's a lot of research showing that more stories like that are going to be what we see. The Kaiser Family Foundation estimates that coverage losses with something like this, 60 to 90%, are going to be people who should be fine but don't understand the bureaucracy and just get tangled up in red tape.
For people who care about this issue and who care about Oklahomans having access to healthcare, what should they be doing right now?
They should go to oksays.com to leave a comment. It can be short, it can be sweet, it can be long, you can go on. But it's really important that Oklahomans like you and I and you be going to oksays.com to register that public comment by January 18th.